So again, T-cell lymphomas is a group of very different presentations depending on the subtype. So we can divide them by the nodal T-cell lymphomas, which are probably the most common T-cell lymphomas where patients present with lymphadenopathy, for example, just like a typical lymphoma would present. Other common T-cell lymphomas are cutaneous T-cell lymphomas. And there really the monitoring differs significantly. Some of the T-cell lymphomas behave aggressively, others have a more indolent course. So let's just focus on the aggressive nodal T-cell lymphomas. And those we monitor very similar to patients with aggressive B-cell lymphomas. So one would get serial scans to assess response to therapy initially. The goal is, of course, with initial therapy to achieve a complete response, after which we sometimes consider consolidation with, for example, a stem cell transplant. And after that, we monitor patients initially every 3 months with physical exams and blood work, as well as surveillance imaging that can be considered on a case-to-case basis. We do know that recurrences in B-cell malignancies for curable entities such as diffuse large B-cell lymphoma are rare after 2 years, and there we usually stop with close surveillance and particularly surveillance with imaging and follow patients less frequently. However, in T-cell lymphoma, recurrences can occur later. So we do follow patients more closely even after 2 years, up to 5 years with serial imaging once per year. That is, at least is my practice. The data on surveillance imaging is not as good as we hope it would be. Clinical examination and clinical symptoms by the patient are often a much better guide than the surveillance images that often kind of produce a false security in patients and the physicians that nothing is going on. So you really have to rely a lot on the patients reporting their symptoms and physical exam and lab abnormalities. For other lymphomas that are less aggressive, again, physical examination and listening to the patients and their complaints is important. I think one other specific topic for T-cell lymphoma is that they can often involve extranodal sites, so not the typical presentation with lymph node enlargement or liver and spleen enlargement that many B-cell malignancies have, but often also involve the skin, for example, and the gut. And these are things that may need special attention on physical exam as well.